Hi! Welcome to Good Doctor. It's me again, Shani, your friendly pharmacist. For today's video, I'd like to share with you my knowledge on how to cure and prevent sexually transmitted disease, or what we so-called sexually transmitted infection or venereal disease. You wanna know more? Don't worry, I got you. Let's not hate, let me educate. According to the statistic of World Health Organization as of July 2023, more than 1 million sexually transmitted infections are acquired every day. What is sexually transmitted disease? STD or STI refers to a group of infections that are primarily spread through sexual contact, including vaginal, anal, and oral intercourse. Some of the common STDs include chlamydia, gonorrhea, syphilis, and human immunodeficiency infection. How do you get STD? First is through infectious agents including bacteria, viruses, and parasites. Second is through infected individuals through various sexual activities. Third, it can be transmitted from an infected mother to her child during pregnancy, childbirth, or breastfeeding. Fourth is through engaging in unprotected sex without the use of condoms. Fifth, having multiple sexual partners or engaging in sexual activities with individuals who have multiple partners can increase the risk of exposure to STDs. And lastly, lack of access to regular medical care, limited awareness of one's sexual health status, and insufficient testing and treatment. The treatment of venereal diseases depends on the specific infection and its underlying cause. It can be bacterial, viral, or parasitic. It is important to note that not all venereal diseases have cure, but many can be managed effectively with proper medical care. For viral causes, to give an example, we have antiviral medications like acyclovir, valacyclovir, and famciclovir that can help manage symptoms, reduce the frequency and severity of outbreaks, and suppress viral replication. Valacyclovir, to illustrate, is an antiviral medication that is primarily used to treat infections caused by herpes simplex virus, including genital herpes and cold sores around the mouth. It is available in tablet form and is usually taken orally. It has a dosage strength of 500 milligrams and 1,000 milligrams available in the market. Most antiviral drugs are in prescription medication in most countries. They are not available over the counter without a doctor's prescription. Its use should be supervised by a healthcare provider to ensure that it is prescribed at the appropriate dosage and for the correct duration. So, how do you take this medicine? Take this medicine exactly as directed by your doctor, or according to the instructions on the label. Do not take more or less than instructed by your doctor. You may take antiviral medication with or without food. But if you experience any stomach discomfort, you may take this medicine with food. Avoid drinking alcohol while taking this medicine. Antivirals must be taken at regular intervals for it to be effective. Do not skip any doses. You must complete the entire course of medicine. If you don't, the infection will not be properly controlled. Continue taking this medicine even when you feel better. Do not stop taking it unless instructed by your doctor. It's crucial to note that the choice of medication and treatment duration should be determined by a healthcare provider after proper diagnosis and evaluation. Additionally, it is important to complete the full course of prescribed antibiotics to ensure that the infection is fully cleared. Preventing STD involves practicing safe sexual behaviors, getting vaccinated if applicable, regularly getting tested for STIs, and staying informed about your sexual health are important. So much wrong information about sexually transmitted diseases gets passed around, and it's no surprise that diseases do too. So learn what's true and what's not. Common things that people get wrong about STDs. Myth is only trashy people get STDs. But the fact is, STDs don't discriminate. Rich people get STDs, poor people get them, athletes get them, math geeks get them, CEOs and professors get them. Even someone having sex for the first time get an STD. The best way to avoid getting an STD is not to have sex or any kind of sexual contact. If you decide to have sex, always use a condom every time, because condoms are the only type of birth control that reduces the risk of getting an STD. Another one is if your partner has an STD, you'll see it. Fact: there's often no sign that a person has an STD. Even doctors often can tell by looking if people have STDs. So, they need to do tests like blood work. People with STDs might not know that they have them. STDs don't always cause symptoms, but it is possible to carry and spread an infection even if you feel completely healthy. The next myth is you can avoid STDs by having oral or anal sex. But the fact is, where there is sex, even if it's oral, anal, vaginal, or even just sexual contact, there can be STDs. The viruses or bacteria that causes STDs can enter the body through tiny cuts or tears in the mouth and anus, as well as the genitals. Some STDs can spread just through skin-to-skin contact with an infected area or sore. Another myth is once you have an STD, there is no chance of getting it again. Fact: you can get some STDs more than just once. Some STDs are yours for life, like herpes and HIV. Others, like chlamydia and gonorrhea, can be treated, but you may get infected again if you have sexual contact with someone who has them. And last but not the least, if you get checked and you're STD-free, your partner doesn't need to get checked as well. But the fact is, your partner would have an STD and not know it. Get tested together. It may not be your most romantic date, but nothing says I care like trying to protect a boyfriend or girlfriend from illness. So remember, be informed, be protected, get tested. If you learned through this video, please like, share, and hit the notification button for more updated videos. See you next time!